hopefully I won't miss a point.
Okie doke. Okay, so good afternoon, everybody, and welcome to the SEN seminar series. My name is Spencer Hayes, and I'm a member of the SEN team. I'm delighted to introduce my colleague this afternoon from our department here in London, Dr. Keri Wong. The title of her talk this afternoon is Post-COVID Recovery, Education, Resilience and Mental Health. Keri is a developmental psychologist. She received her BA Honours in Psychology and MA in Criminology from the University of Pennsylvania in the US, and a PhD in Psychology from University of Cambridge in the UK. She was awarded the Betty Behrens Research Fellowship from Cambridge to study causes of antisocial behaviours and schizophrenia spectrum disorders. And Keri is currently the lead of the UCL Penn Global COVID Study, which looks at the impacts of COVID-19 on mental health, physical health, and social trust, which is the basis of her study this afternoon. So without further ado, once again, delighted to introduce you, Keri, and I look forward to your talk.
Thank you, Spencer, for the wonderful introduction, and welcome everyone and joining me for this afternoon talk. As Spencer said, today I will primarily be focusing on some of the data collected as part of my UCL Penn Global COVID study. But because I always forget, I wanted to let everyone know that we are organizing a summer webinar series between June the 2nd and July the 28th for 5 of the Wednesdays during this period. So do check it out. You can head over to our website to learn more, and Spencer will be dropping a link in the chat box as well, so you can feel free to read more about the various papers we have that we'll be presenting, but also to sign up as well on Eventbrite. We also have several social media accounts for the study if you want to stay in touch with us, as well as a lot of our study materials are on the Open Science Framework website link that you see here as well. So if you're not sick of me by the end of this talk and you want to hear more, do join our webinar series this summer. As part of this talk, however, and for the last, I would say, year, I've really been thinking more about, how I can apply my expertise, obviously trained as a psychologist and criminologist, but I work with school children, or I have been working with school children, teachers, and parents throughout my career so far. So really thinking about how my knowledge and expertise in mental health can inform education, that's really been the crux of, a lot of my thinking I would say, especially this past pandemic year. And some of the questions, obviously, based on media coverage and whatnot, I've listed some that I've been thinking about. How do we better reopen schools? What is it that we've learned through teaching? What are some things and good practices that we should be keeping, perhaps, even post-pandemic? How do we build resilience into the educational curricula that we design and tailor to our students, as well as how do educators and learners become more resilient as well? So these are kind of questions that are more recent, but the idea, even the whole topic and focus on mental health and well-being, isn't a new one. And pre-pandemic times have shown us that there has already, even in schools, been issues or concerns that we should be highlighting in terms of mental health. But during the pandemic, I think these issues have really been magnified. And so today's talk, I really want to focus on 2 questions. What is the impact of COVID on education? How does mental health data inform education practices, as well as our thinking of, of the new year and the start of term and so forth? So in the first part, really, if we looked at all of the COVID studies that are continually publishing, I must say, in this very active area of research, the general consensus is that the COVID pandemic has really negatively impacted, I would say, everyone's mental health. So, there has been many COVID birth cohort studies that have quickly responded to adding new measures in their recent waves to collect in kind of urgent data now so that we can compare how people are doing right now to compare to like pre-COVID times and also inform future policies. Other studies have focused on mental health during COVID times, like the one that I'll be showing you today, my study, but also thinking a little bit about the longer term impacts of COVID on our health. Various studies have focused on specific populations, be it SEN populations or ethnic minority groups, those with pre-existing conditions, or specific even age groups. But here I'd argue that there are fewer studies actually in the literature where we actually compare across these groups. So for example, are those with pre-existing conditions necessarily or significantly different to those without pre-existing conditions? And I mean, just pause for a minute to reflect on how the pandemic or your experience of the pandemic has been. You know, many of us may not be only confined to one label or a particular group, but that the pandemic really has affected all of us at varying levels and intensities across our lives. So I think bearing that in mind a little bit, perhaps I'd argue one of the some of the findings I'll be presenting compare across or take on a more broader perspective of the population that we are investigating. If we were to look at the studies, particularly focusing on educators and their mental health and well-being, here's one from Education Support and YouGov, where they published last July. I'm sure they have more recent data as well, but it shows that compared to the 12 months prior to the pandemic, school teachers and leaders have reported higher levels of or poorer mental health and well-being, and that it seems to be substantial and significantly different to the 12-month prior before pandemic. Other stats that have come up include, you know, increases in various mental health symptoms, as you see here. And I think all of this data is very important and helpful for us in understanding the kind of current situation right now, how people are feeling in terms of their health as well as their well-being. But also the other important question I'd like everyone perhaps to consider today in this talk is also the sustained impacts of these symptoms. So as we know, you know, mood changes all the time, and perhaps even the way in which we measure these things based on questionnaire responses can vary quite a bit, sometimes from weeks or days. And so understanding how these negative symptoms are sustained over time may be a more helpful question to ask to then help us think about who necessarily needs the more help or resources. Here's an example also from the Oxford Co-Space study, which is a study focusing on young people's mental health. Here, what they found is that they've asked parents to report on children's mental health and well-being. And, you know, you can see here the x-axis is time, and the y-axis is kind of a measure of children's well-being, split into behavioral symptoms, emotional symptoms, and attentional symptoms. And you can see that actually the study authors have shown that these symptoms actually fluctuate across the pandemic year. And that, again, coming back to my point of showing or demonstrating sustained negative impacts over time, I think would be important to understand how or which particular children perhaps are most affected. And so this brings me to my study, which is a collaboration across 5 institutions spanning the US, Singapore, Italy, and obviously us in the UK. It really is a big team that we have. And here are some of my collaborators also from UCL. What we did was we launched an online survey, which lasted between 20 to 30 minutes. And it was administered through Qualtrics. We had in mind actually from the get-go that we would have 3 waves of data collection. And the reasoning really, 3 waves of data collection about 6 months apart. And the reasoning behind that was also informed a little bit by my own experience of being a teenager growing up in Hong Kong and having gone through the SARS epidemic. So I knew, that during the first lockdown, this pandemic clearly wasn't going to be something that we'd just forget in 6 months' time. If anything, there were perhaps even potentially more mental health issues 6 months from the first wave, I was thinking, primarily because there will also be, it's also flu season. There might be other things compounded with our, pandemic situation. What I had not realized was that it would coincide with the UK lockdown as well during wave 2. And so that was, it's interesting now in that we are currently in wave 3 data collection. We started on the 17th of April, so it's been about 3 weeks, to now look at the data to see when things start reopening and lockdown easing of restrictions are happening, how this data perhaps compare to the past 2 waves. In our study, we measured a bunch of variables. I would say perhaps a bit more than most other COVID studies out there. But don't quote me on that. There might be other studies also that measure things extensively. But we did really try to capture as a wide range of background variables, as you can see here: people's access to green spaces, living conditions, home environment, range of mental health measures, as well as things and behavior, like things like physical activity, as well as alcohol consumption and substance use pre and post COVID times, to see whether there are changes and differences there. I also have a personal interest in looking at social trust in others. And so many items are also related to relationships, relational conflict, parenting, loneliness, stress, and so forth. You can find an extensive list of our measures on our open science framework. We also, I would highlight here on this page, it's a bit confusing, but at the bottom 3 lines, those are also qualitative questions we had asked as well in each of the 3 waves. So just to give everyone a bit of more of a demographic idea of the characteristics of our participants, after in wave 1, so that was last April till July, we had about just over 2,000 participants take part on our Qualtrics survey. I would say after filtering, cleaning the data, about 1,800 of those are eligible and we've used in our analyses. And this group in particular, just to give a sense of who they are and what they're like, about 54% are under 34 years of age. They range from 18 to 89 years old and are and 70% of our sample are female. And this is kind of consistent with other COVID studies out there as well, the females being more active and taking part perhaps in these surveys. And then a large portion, 40%, are from the UK, or respondents from the UK, followed by Greece, the US, and also Italy. And about 50% of our respondents earn just under 40,000 pounds. By wave 2, and you can see also that I'm doing all these analyses as UK is easing lockdown as well. So it's perfectly timed. By wave 2, this was between October last year till end of January this year. And here we had about 1,200 follow-up responses from our original sample, with also new joiners to the study, about 500 of those. And in that group, we saw definitely perhaps a decrease in participation in Greece and Italy, but similar rates in the US, and proportionally, there are more people from the UK being represented. In terms of age range and also income level, perhaps not that different to wave 1, as we can see. And wave 3 has just started, but today you'll see a glimpse of some of this data from about 650 of the participants that we now have data on. So what did we find? And here I'd like to, maybe just present briefly 3 kind of key findings we've documented. The first is in relation to mental and physical health. The second is kind of looking at stressors, but also short and also longer term stressors. And then finally looking at loss, the idea of loss and also recovery, and leading straight into a discussion with everyone here on the call today. So in terms of mental health, this is kind of the trend that we see, or the pattern that we see when we look at mental health measures in our study across the age groups that we have in our sample. As you can see here, I've highlighted the younger participants in our sample tend to report higher levels of depression, anxiety, less physical activity pre and post COVID. Higher levels of aggression, poor sleep, as well as stress compared to the older samples in our group. In particular, I would say, it would be almost, I would say, trending, if not significantly higher than the 35 and above groups. What we don't find age differences in are measures of loneliness as well as empathy. We found gender differences in two of the variables, not surprisingly in anxiety and also empathy. Women reported higher levels of anxiety compared to men, but also higher levels of empathy compared to men. But again, caveating this that 70% of our sample are female participants. I think, just remembering that and contextualizing the findings a little bit there. One of our papers that's now gone through revise and resubmit purposes really highlights changes, actually, interestingly, across the lockdown duration in levels of loneliness. So based on people's reporting of loneliness levels, we can predict, in a sense, how long they've been in lockdown. So interestingly, what we found was that at the beginning and end of the lockdown period, there were definitely people were reporting higher levels of loneliness, but somehow in the middle of the lockdown period, levels of loneliness actually was very low and significantly lower than the beginning and ends. Whether these findings replicate wave 2 and wave 3 data still needs to be analyzed. But my gut feeling is, having this knowledge of how people are doing during the lockdown period and duration is also helpful knowledge for both governments and in policymaking, and in kind of informing the public that actually, you should be expecting for your mental health to fluctuate during the course of lockdown. But also here are some things that perhaps you can do to avoid feeling lonely and so forth. So I think there's still some helpful information that can be helpful for individuals now, as well as if we ever have future lockdowns, for governments to consider and think about their policy as well. In terms of specifically teachers' mental health, because I know this group has an interest in this area as well, we looked at comparing those who self-identified as being in a teaching or educational professional role versus those people from other occupations. And when we compare these two groups, we actually find no differences in a lot of the variables that we just covered in the previous slide. And this is controlling for country as well as gender and age differences as well. So interestingly, even though you might read, and we started the talk today with all of those stats showing increases in poor mental health and so forth, I think the maybe the next question for other researchers too, and if you have data, definitely let me know what you find, is to actually perhaps compare across these groups to see whether or not these differences are significant. Significant across the groups, and that will in a way help us think about what is it that we need to be focusing on as a society. Is everyone just equally affected, and if so, what are some things that we need to all be doing then, right? In another paper that I'm currently working on, we wanted to look at, obviously, my interest in trust in other people, perceptions of others. I was interested in thinking whether or not the COVID pandemic has increased levels of paranoia in the population and mistrust in others, and how that really relates to our measures of mental health. This kind of diagram you see here is what we call a network analysis, or you can think of this as a social network. All of the round circles are a variable that we had just discussed. So here, GAD TOTS, that's actually a measure of anxiety. And here next to it is depression. And the line linking the two together in blue is showing us that there's a positive correlation between the two. And at 0.5, that's pretty high. And kind of consistent with a lot of the COVID findings out there. Even pre-COVID times, we know that high levels of anxiety is also correlated with high levels of depression. But the question that for this paper we wanted to ask really was whether we see the same structure in how things are related to each other across different groups of people. So for men and women, do we see the same structure? For people who are younger versus older, do we see the same thing? If not, perhaps then it means maybe that particular group is suffering more, perhaps, because we see these variables being more tightly connected with each other. And so we tested this in a range of different networks for gender, for age, so older versus younger people, for the UK population versus those in other countries, as well as lockdown period, because this is based on our data from wave 1 and wave 2. And lo and behold, we do not find significant kind of structural differences. We see the same pattern that you see here on this slide for all the groups, okay? What we did find and we wanted to ask further was whether these links between the variables might be slightly different for these different groups. The only kind of main finding we got out of this was by lockdown period. So the hypothesis that perhaps during lockdown 1, no one knew anything and everything was quite chaotic. Therefore, maybe all of these variables or symptoms are plentiful and things are really highly connected. Then the hypothesis would be maybe by lockdown 2, things are a bit better. Maybe we only see stronger connections between those variables that really matter and are stressing people out. What we find between comparing time 1 and time 2 networks is that there's a slight, very marginal increase in levels of stress. And that there are slight increases in poor sleep as well. People were saying that they were reporting poor sleep. However, there were also decreases in levels of aggression that people are reporting, as well as lower levels of schizotypal traits, which here consists of paranoia and thoughts and mistrust in others as well. The key point, again, that we've identified really from this paper is that loneliness, which I have pointed in a red arrow here, is a key influential variable that we found in this network. As you can see, all these blue networks actually are the paranoid thoughts, mistrust towards others. It's really linked to these mental health measures down here: stress, sleep, anxiety, and depression, really through this variable of loneliness. So it seems then, or at least one thing that we're currently writing the discussion about, is that perhaps there are things we can help improve or reduce the levels of loneliness in all of us, given that it doesn't affect or is not different across the board. But perhaps reducing levels of loneliness can perhaps break some of these negative relationships and links that we see here on this network. And so I'd love to hear about your thoughts as well on these findings. And obviously that the version I'm presenting now is just my interpretation. The second kind of finding that I'd like to present to you are data that we looked at in terms of stress. So across the 3 waves, we asked the same question. We got participants to identify and select from a list of 30 different stressors. What were the key stressors that stress you out? And then to what extent these stressors have affected you? So here I'm only presenting the prevalence rates of these stressors. As you can see from wave one, all the yellow bars, the top 5 stressors that people have identified with over 50% or so participants here, they say, other people not social distancing, the uncertainty surrounding COVID, future plans, mental health, boredom, and loneliness were really kind of the things that were key stressors for them. They were then followed up with additional questions, but just bear with me in terms of prevalence rates as well. So in wave 2, which is the blue bars, we added one more kind of stressor category to this. And this is the people's understanding of government COVID guidelines. And as you can see here, interestingly, the top 5 bars now in wave 2 are stressors. Other people not social distancing was definitely a key one, followed by the uncertainty surrounding COVID, future plans, other people not wearing face masks or gloves. And then kind of government COVID guidelines was well up there in the top 5. And so in the most recent findings from wave 3, again, it's only on a smaller portion of the sample. This is the kind of finding we find. I was interested in seeing, it's interesting to see actually that people have found it less stressful than before. Here's a long list, which is great. But there are also a few things that people have identified, and these are, increasing prevalence rates across the 3 waves, including mental health, physical health, work, as well as marriage and romantic relationships being kind of more stressful than it was in the last 2 waves. And then here are some things that people found were perhaps as stressful as waves 1 and 2. Other people not social distancing, future plans, boredom and loneliness, finances and job security to a lesser degree, but still quite, they're stable kind of stressors. And so I'd argue perhaps that, some of these more stressful things perhaps are things that we should be thinking about addressing across the board, both in schools as well as in society. And finally, coming to the last set of findings, I wanted to present some data on looking at recovery, but also on loss. So a question I had asked our participants was, how has the COVID pandemic affected you and your family? So here, I'll give you a couple minutes to read this because I think they're very interesting. And if you can, I'm gonna let Spencer maybe let me know, but if you can throw in the chat there whether or not you can relate to these comments. And important question here would be, what age range do you think these comments are from? Which age group of participants do you think they're from? Okay, so I don't know if there's anything in the chat, but if you could throw in the chat there whether or not you can relate to these comments, and also what age group you think these comments are from. I'd be interested in seeing what the answers are.
Keri, some comments are that, yeah, a lot of those resonate with some people that are in the audience. Seems to be suggested of the younger people, not the oldest people, perhaps. That's what seems to be in the chat at the moment.
Yeah. Okay. And actually, Spencer, I just realized that we didn't launch one of our polls at the very beginning. So maybe we can actually launch the poll now, just to get a sense of who's in the audience, because that would be very helpful for me.
We've got actually got a lot more people pinging comments into the chat now. Great. Yeah, so I'll read those out to you then.
Yeah.
So sort of top lines then, introverts versus extroverts. I can relate, most maybe early 20s. Mm-hmm. I think almost all ages can, so comment that all ages can resonate with those comments. Question rather than a statement, has affected less people without children, perhaps. teens, question mark, people perhaps with different types of phenotypes, so maybe ADHD, for example, mid-range in the 20s, so people are suggesting maybe younger people, I guess, really.
Okay, very interesting. And so, yes, so a lot of them saying it's younger. So this is actually a very quick poll I did in a recent talk. So all these comments were from 14 to 18-year-olds, only 16 of them. And I've taken out a few of them that I've added here, which would have made it more interesting. But I wanted to, more obvious what age groups they're from. But I wanted to, I guess, get people to think actually some of these comments are probably things that we're also going through, perhaps regardless of age. Some of them transpire. I can certainly relate to like stress, family tensions, etc. But also, I think with young people, there's the added concerns also about the family structure, conflict in the home, perhaps them having less control over those things as well, and them preparing for the future. And so a second question we had asked, which we have also asked our study participants, which is what support would you or your family need in the next 6 months to thrive and recover from the pandemic? And similarly, these are some of the comments from the young people that I had presented on the slide earlier. I think some of them really resonate with me, and sometimes a part of me feels like I don't have children, but a part of me feels like, they're very good at identifying some of these things, such as, even suggestions for educators, for those of you who maybe are educators or teachers on the call. For example, time away from school and understanding, maybe more space and time alone outside of my home. So some of them are asking that, but also specifically for the classroom, I feel like schools should provide an outlet for students to possibly vent to. I also believe there should be a lot more understanding with others. There are also other comments which I find interesting, including that therapy has helped some students and that they really need help or want help in rebuilding relationships to kind of, post-pandemic. And so forth. There are some, suggestions of even coping strategies of how young people have been coping with the pandemic, and perhaps something that we also should be emphasizing as well for generally everyone, if we are able to share some of these good practices as well. So in the field, however, there seems also to be a discussion and contentions about rules. So in schools, there seems to be one set of rules. Outside of school, there seems to be a different set of rules set by government, and that's constantly changing and perhaps confusing both, almost everyone from teachers, parents to students. Perhaps there needs to be more thought, discussion around that for all of us to think of solutions that are viable. Many students are also, some of them are feeling excited to return to school, others are fearful and stressed, including their burden that they feel when if they were to bring coronavirus back home, for example. And so perhaps a lot of what we're hearing, even from young people in terms of anxiety, are things that we ought to be addressing when we're thinking about returning back to the classroom. And even prior to that, perhaps there are definitely conversations and room for conversation even before returning back to school that can also take place perhaps online, is one suggestion. So on that latter question, we had asked our, study participants. So these are again 18 and above now, so not the young people. And some of the themes that we've identified include the following, and this is based on a sample of 653 participants. The first one here, this is definitely a minority. I think maybe only I saw 2 comments on this, which say that they have all the support they need, but they would really want to do more in the community and improve their community. The other kind of major theme that came out of the responses include financial support, both from, I guess, the government as well as support from the employers. There's a lot of talk also about flexible work hours, and many people saying that they feel like they've worked nonstop, and I'm sure maybe many of us on this call can also relate to that as well. The other big theme that came out was on mental health and well-being, I would argue. There's talk on encouraging more therapy work, and some people saying that they need access as well as continued access to mental health support. How do we factor that in and into our planning of recovery? I think is definitely a question we need to talk about. But also, comments about getting young children also involved with counseling or access to CAM services as well as something that parents in this case are voicing. The other kind of theme that has come up relate to government guidelines and trust in the government, I would say, in terms of the messaging that's coming through and coming out. Also related to government messaging or messaging in general. Some people have said, well, actually, we want our employers to let us know or give us reassurance that returning to work on campus or the office is going to be safe. And that they want more flexible working hours. And then this kind of comment here at the very bottom that I find interesting and true is that people would feel more safe if they know that a lot of the, there are still going to be some sort of guidelines and not just complete easing out of lockdown. And this brings me to kind of the third set of kind of ideas that I've not necessarily categorized, but I think it's more of the longer term things that we need to think about as a society as well as employers and so forth, including the idea of grief and loss. Many people who have, and we know this, that there's an increase in number of people that we know in our direct circle or even second to third circle who have passed away as a result of COVID. And so our whole society in terms of the way in which we grieve has not been the same at all, and many people do not have access to that community that we would normally have. And so other thoughts on kind of how it might be traumatic returning to work as well, that's also been voiced. Including clearer timelines for the future, as well as if perhaps even if we were to have another lockdown, what might that look like, and what preparations can we do to better prepare for that, right? And so I just quickly wanted to show kind of the idea on that last idea on loss. I did ask in our study, do you know members of family have tested positive for COVID? So positive are the blue bars. And across the three waves, you can see that there's an increase in percentage of people knowing that, other people being tested positive. But then also when we look at number of people that people know have passed away, and we're going to be looking into more detail in this data as well, is to see, the proximity in which we know of someone who's passed away, whether that also affects our mental health and well-being. And clearly that is something you would expect, the more people who in your immediate circle who have passed away due to COVID, the more perhaps your health is affected across the board, and therefore perhaps that might also be like a group of population that we need to dedicate help and resources to. And so final part, this is really the opening. I'm going to open this up to discussion in a second. This idea of how does this mental health data inform education then? Here I've covered some of the global initiatives that I know are are happening at the moment, including studies looking at low-income countries worldwide. For example, we know even prior to the pandemic that 250 million children were already out of school, and so many more are perhaps unlikely to return to schools. And then, there's been some talk also by key speakers from the World Bank saying that actually, in light of this pandemic, and even prior to this pandemic, we were already considering harmonizing data. So connecting data sets, things we know about people's health with social as well as fiscal policies in this case, and that infrastructure really needs to take priority now, given that we really should understand the whole context in which these things are happening, and thinking about, how to best respond perhaps in the future. We need better and more connected data available on a population. But that, of course, also has issues with GDPR and all of that. So I think it's, these are conversations that I feel like we should be having now, especially in light of the whole year of the pandemic, but also that these conversations need to be happening at the macro level as well. And then thirdly, there's also work been done looking at issues of poverty, safety, all of that in low-income developing countries, to then see how do they recover also from the pandemic. And really there, the consensus of effective intervention is working closely with local leaders. And in the context of education, it's about working and offering teacher training on kind of mental health issues and things like that. There are also local initiatives, which I'm glad Joe is on this call, because we co-wrote and presented some, or not presented, but co-wrote some evidence that we had submitted to the UK Select Committee recently, looking at children and young people's mental health. And there really we made a few recommendations, but one of them being, sorry, is someone on mute? One of them being that, school children should get kind of regular assessments of mental health in early development. And this is something that not just myself, but other researchers have found as well, that many children who don't meet perhaps the threshold on a certain questionnaire or measure for needing help, they often do not get any help in the end. And perhaps then what really needs to take place or happen in schools in particular, and schools is the best possible kind of context to do this, is to get an assessment of everyone. Like when we get, an assessment of academically how people are doing, how young people are doing, we ought to know exactly how they're doing or faring emotionally as well. And even having kind of low intensity interventions might be helpful for young people, so that they don't develop and have more severe kind of conditions later on in life. We also recommended increased teacher training, so making it easier for teachers to recognize the problems, which many of them already do, but not to burden them also with the mental health services or practices that they're meant to exercise, and instead enable them to refer their cases or children to CAMS more easily. And then finally, kind of having tailored school interventions, like in the ones that I think are in our field, looking at bullying interventions. So the most effective bullying interventions are the ones that take a whole school approach. It's changing the whole school culture to enable everyone to know and be on the same page. And so just to summarize really quickly then, when I started the talk with looking at how mental health and my expertise perhaps can inform education through making programs and individuals more resilient, I would argue that, by the end of this talk here now, just to point out that there are very mixed kind of COVID findings as well, coming out of COVID studies. So oftentimes we need to think about the nuanced samples that they are looking at, but also I would argue that, a lot of these studies are very good and may have even longer term impacts as they're currently collecting kind of time sensitive data for what's going on now, and also perhaps hopefully be able to better inform future policies. The second point, just to summarize, is that we really do need to tackle also the current issues that we are identifying and what a lot of papers and studies are coming out with. For example, many studies have identified loneliness as a key variable that we need to be focusing on. And so what are some things that we can do locally and globally to help address this? For example, Norina Hertz, who recently wrote a book and she focuses on kind of macro strategies on how to address the issues of loneliness. And some of her recommendations include, for example, government investments in local communities, including the cafes and the parks and so forth, because those are key places where the community gathers. And those are kind of key businesses that enables our society to thrive. So other things include, our knowledge from psychology and other fields, looking at tackling stress and trauma and improving sleep. So we have known ways of helping people, and that probably needs to be addressed now, or at least people should know about it, and it shouldn't be kept in these silos. And then finally, the point that perhaps we should be reflecting on what we know now, what we've learned, and constantly reassess how we can recover as a fairer society, fair education system, and more resilient education system as well. So yes, that's the end of my talk. I'd like to, again, just highlight and flag the summer webinar series. It covers quite a range of topics, as you can see here, from relationships, families, to higher education, and also perhaps considering some solutions as well on how we recover out of this pandemic. And that is it. Thank you so much.
Thank you so much, Keri. Before I thank you again, just to remind people that I've posted the link to Keri's webinar series in the chat, so you can grab it there. Mm-hmm. I know you've worked extremely hard on this project, Keri, and I think that's pretty evident in the team that you've put together and the data that you've managed to gather over the last year. So very well done on that. When we had our pre-meeting yesterday, we said we're going to deliver some polls, and we haven't done any of those polls yet. Did you want to post one of those polls?
Yes, of course, still around. I guess let's launch this one.
Yeah.
I wanted to launch this at the beginning, but this was meant to give me a sense of who is in the audience. But perhaps we have quite a few young people.
So people are polling away. So can you see that, Keri?
Yes, I can.
Okay, and perfect.
I will, once all the polls are in, I will share that. So we'll know the range of participants on this call. Just a couple more seconds, I think it will close. And then we have just a final poll, which is perfectly timed then, because we have reached the end of the talk on that. So let me just, let's end that. Great. So there are quite a few teachers, but mostly PhD grad students. Welcome. Education psychologists, academics. Great. Thank you very much for joining my talk. And I'll just launch this last poll as this is actually timed correctly in my talk. Yeah. And this is really to see whether or not this has been helpful, and hope it has been. But obviously, you can feel free to say no as well. This is anonymous. And I think we have just over half have responded. And I'll share the information and responses in a second. And I'll stop sharing my screen after this, so you can ask me questions. Okay, then I think looks like it's it. Great. So somewhat majority, some said lots. You guys are very gracious. No one said no. And that most of you say maybe you'll use this information. Great, thank you so much.
Yeah, thanks, Keri. I think it's pretty evident that, as you indicated in some of your data, that everyone's been affected by the current situation. So that seems Great. I'll start the questions then from reading from the chat.
Sure.
As per usual, guys, if you'd like to ask Keri a question, please feel free to put your hand up or just unmute yourself and put your camera on. So I'll start off. This is the question I was actually going to ask, and it's very interesting actually from Kathy Weston. Often schools agree that early intervention is a good idea, but can't find appropriate survey or assessment tools. Can you advise on which tools teachers could use, please?
I think this is definitely a conversation that a lot of not just researchers are asking, but having kind of one, I don't think there's one particular tool that you can use. I would argue that, I mean, Joe could probably come in on this as well, that the strengths and difficulties questionnaire is a commonly used one. But arguably, is that the best tool? Many say maybe, maybe not. And actually, I think increasingly so teachers are going to be working with CAM services. I know that there are CAM support teams that are now, at least they're piloting even before COVID, to work with schools so that teachers aren't the ones then responsible for administering these tools or finding out, as you say, which tool works best. So I think there should be more of that. Actually, teachers shouldn't be the ones who have to find the tools or right tools to assess mental health or wellness of their students, but really it's more collaboration with the CAM services perhaps in administering those assessments. Sorry if that doesn't necessarily answer your question directly, but the most commonly used one is the strengths and difficulties questionnaire, which is a 25 item questionnaire that has like teacher report, parent report, student report as well, depending on the age. So yeah.
Another question, why do you think the 18 to 24 age group, out of all the age groups, more likely to report having anxiety, depression, etc.? That's from Tamara Reed.
That's a good question, and I think we get this question every time. I think there could be a multitude of reasons, but some of them could be that the younger people in our sample are also perhaps more willing to disclose and say, endorse items such as anxiety, depression, etc., compared to our older populations and groups. Similarly, more contextually, I would say perhaps young people are perhaps most affected because they're the ones who ought to be traveling now and going places, and that the lockdowns and restrictions has really challenged that. In many cases, young people have to financially, maybe they're not also they're as well off as the older participants in our sample, and that they're not perhaps used to that lifestyle too of staying at home and just watching movies or something, compared to perhaps the older groups. That's what they would prefer, so I can imagine how that, and also in addition, kind of uncertainty towards their future and plans being disrupted. So yeah, those are, I think, some suggestions, although we don't have, I think, data to answer that explicitly.
Yeah, fair comment. This is from Cynthia, who's a teacher. From my experience as a teacher, CAMs prefer to send their own assessments, of which the SDQ is one. The problem is more length of time that passes between referral and first assessment.
Yeah.
And processing of it.
Yeah, I think there's also, I mean, not in my study, but completely agree with you, Cynthia, that the wait time, service wait time is definitely something that a lot of other researchers are addressing and clinicians as well. I think here that would speak to a bit to my point about having actually low intensity interventions that are available to a wider range of students. I mean, one example might be that, and many young people tell me this too, when I speak to them about things at school, they ask me, why isn't psychology being taught, in primary school even? Like, it's not like the concepts are particularly super advanced in that sense that they don't understand it, and here it might be as simple or basic as teaching or getting young people to understand their emotions, which I think a lot of the SEAL courses, they talk about that, but also getting young people to think about strategies on how to deal with stress, right? I mean, if I were to pick one subject in school that maybe all children or people should take, it would be how to manage stress, because this is something, again, from young and old, throughout your whole life, you're going to be faced with multitudes of varying levels of stressful things. And so how is it that, are we really equipped to deal or handle with stressful events, or we only figure out those things out when we actually experience them? So yeah, that's just my thought though. I don't know if it's evidence-based. So yeah.
Yeah, exactly. One of the I think one of your comments from the qualitative remarks is about scientific evidence for parents. Do you have any ideas on how teacher training or kids training of mental health could happen at a kind of school level? You mentioned school level being maybe an optimal tactic or technique. Any ideas on that?
Yeah. So I did also highlight, the similarities with perhaps in looking at the literature of effective school bullying interventions, because bullying, obviously, it happens in every school, and it is also a key experience that's been linked to a multitude of psychological issues at the moment, and also future psychological kind of issues. And so I would envision perhaps mental health or school-based mental health approach to be very much similar or tied into the bullying, anti-bullying curriculum as well. It's not like these topics are or should be thought of as distinct, and they are always interacting. And if anything, it's important that we talk about behaviors, mood, and emotions, because all of this impacts also how well children are functioning in school academically and throughout the development. So yeah, the vision of the school-based approach, obviously there are so many different levels, but I think a kind of baseline of it would be that mental health issues do matter, and they do exist even when young children are very young in primary school, and it shouldn't be something we ignore completely. And then when it arises in, say, teenage years, that suddenly it becomes this thing that we have to talk about, or suddenly it's like only happens in the teenage years that it becomes a concern. Yeah, so.
Yeah, absolutely. I am mindful of time, so I'll just make one comment, and I'll end with one of the comments in the chat, which I think is quite interesting. You're absolutely right. In lots of the teachers that I work with from autistic schools, and some of the survey data that we took from the COVID pandemic was that autistic children are also disproportionately affected by mental health issues, but also this seems to have been impacted to their parents also. In that pandemic. And a comment here from a parent of a teen, quote unquote, from Kendra, is that perhaps this is in reference to teenage children, and perhaps trying to grow up when you're stuck at home with your family is stressful. So we have to give children their own due in the fact that they have been affected both in educational terms, changes to examinations, for example, and that is super stressful. And perhaps living at home with their parents is also very stressful at this time.
Exactly. And I think as educators, then, it's more difficult to change every environment of a family home. Probably impossible, like as a policy, impossible, in terms of actual feasibility. But perhaps as an educator, focusing on school environment, context, and what we can do in the classroom is something within our control a little bit more. So I would, yeah, definitely.
Yeah, absolutely. It's 5 o'clock, Keri. So thank you so much for your time this afternoon. It's pretty evident to me from looking in as a colleague of yours that you've done an exceptionally good job trying to tackle this question, and you put a lot of effort in. So thank you very much for your time, and good luck with the study and the papers, obviously. And on behalf of the SEN team, to everyone here, then have a lovely afternoon and a good evening wherever you are. Stay safe, and we'll see you next week. I believe Joe is going to host you next week. I'll be here, but have a good evening, and take care.
Thank you. Bye.